Discussing weight during pregnancy can feel challenging, but with the right approach, it can support both mother and baby's health. This video offers practical strategies for having supportive, non-stigmatizing weight conversations as part of routine maternity care. Weight is just one health measure among many that helps us monitor pregnancy health, similar to blood pressure or blood tests. However, unlike other measures, weight can carry social stigma and emotional significance for many women. Research shows that weight stigma can discourage women from seeking healthcare and reduce trust. This ultimately impacts health outcomes for both mother and baby. Weight conversations done well can support women to have a healthy pregnancy, build trust between you and the woman, reduce anxiety around weighing, promote long-term health behaviours based on well-being, not shame. Before raising the topic of weight, check your approach. Reflect on any unconscious biases you might have about weight. Do I make different assumptions or recommendations based solely on body size? Am I more likely to attribute health issues to weight for larger patients compared to thinner ones? Do my interactions, time spent, language used or eye contact differ based on a patient's size? Use neutral, person-first language. Ensure your clinic has appropriate equipment and privacy for weighing. Remember, women come to pregnancy with their own history and relationship with their bodies. Consider screening for body image concerns early. Ask, do you have any experience of disordered eating or exercise? How do you feel about the way your body is growing and changing at the moment? This helps identify women who may need additional support. When it's time to discuss weight, 1. Build rapport first by addressing other health concerns. 2. Ask permission to discuss weight. Examples: would it be okay to talk about your weight as part of your overall health? Is it okay if I weigh you today as part of your routine care? How would you feel if we talked about managing your weight today? Explain why weight is being monitored, such as, we monitor weight to help ensure your pregnancy is progressing well. This helps us provide the best care for you and your baby. Weight gain is expected in pregnancy, and we want to monitor that it is happening at the right rate, because too much or too little can affect you or your baby's health. Respect if someone isn't ready to discuss their weight. Say, that's completely fine. We can discuss this another time when you feel more comfortable. Let them know your door is always open when they're ready. When weighing, explain the procedure first. Offer privacy. Provide the option of blind weighing, where the woman doesn't see the number. Avoid commentary about the actual weight number. Focus on health. What to say after weighing. Thank you for allowing me to check your weight today. Your pregnancy is progressing as expected. How are you feeling about your changing body? Always check how the woman feels about the weighing experience. If the woman is gaining weight too quickly or outside the recommended weight gain ranges, it would be useful to let them know. Some ways you may bring this up include, your weight change at this stage of your pregnancy appears to be higher than we would expect. Have you noticed this yourself? Would you be okay if we tried to see what might be causing this? The words we use make a big difference. Say weight, higher weight, BMI is above the recommended range. Avoid obese, fat, overweight, excessive weight gain. Focus on health behaviours rather than weight. Ask, which healthy foods do you enjoy? How do you stay active in ways that feel good for you? Avoid simplistic advice or blame, such as, just eat less and exercise more. You're gaining too much weight. You're at risk because you're obese. These approaches are demotivating and ineffective. After discussing weight, ask what support would be helpful. Collaborate on small, achievable, smarter health goals. Provide resources on nutrition, movement, and body image. Arrange follow-up if needed. Managing body change expectations during pregnancy is important. Women need to understand that these changes are perfectly normal and that recovering after pregnancy takes time. When we take the power out of the number and focus on health, we see better attendance at appointments, reduced anxiety and depression, healthier pregnancy behaviours, improved maternal and infant outcomes, better body image and self-confidence. Weight conversations in pregnancy can be supportive and empowering when done well. Remember, weight is just one health measure. Focus on health, not numbers. Use supportive, empathetic language. Empower women to make healthy choices. Together, we can create a body-confident maternity care environment that supports the health of mothers and babies. Thank you for watching. You can find useful resources on this topic by scanning the QR codes on screen. For more information and resources, please visit bump2babyandme.org.